Achievers never expose themselves, but their achievement expose them. Before the lunch, let me first acknowledge the presence of our eminent chief guest, Dr. S. Karthikeyan sir and Mr. Atheena Milagi Pandian sir, our respectful department HOD ma'am, dignified faculties and friends who are gathered here. We will have our traditional auspicious lamp lighting ceremony as a tribute to the Almighty. I would request the esteemed chief guest, Dr. S. Karthikeyan sir and Mr. Atheena Milagi Pandian. Please sir.
After this devotional and divine lighting of lamp, I would like to request everyone to rise on your feet for Tamatai Varthil. Thank you all for rising up, for exposing your gratitude. I request everyone to take your seat.
I would like to solicit our event coordinator, Mr. R.R. Jagan sir, to welcome the gathering.
Good morning to all. It gives me immense pleasure to welcome all for this National Symposium Sidewalk 2K22. After this pandemic, we are sitting in a single roof. It is very happy to see you all. First of all, I want to welcome our today's chief guest. The eminent persons, we have two chief guests. One is S. Karthikeyan sir, doctor from Karur, and AtheenaPandian sir. Welcome you, sir. Then I extend my welcome to our respected Principal Sir, Dr. V. Nirmakanan sir, and Dynamic Vice Principal, Professor T.S. Kripasanga sir. I welcome you, sir. And I welcome Department Head Mrs. Swarnada Ma'am and various department heads, faculty members, and other college participants and my dear students. I welcome you once again. I think this session will be, this whole day will be so informative. Kindly use the session and cooperate for the successful. Thank you.
Thank you, sir, for your wonderful speech.
Honor is the tribute that is done with gratitude to inspirational and successful people. Now, I would like to respect our principal, sir, Dr. V. Nirmal Kannan, sir, to honor our chief guest, Dr. S. Karthikeyan, sir, with a memento and a shawl. Please, sir. Thank you, sir. Now, I would like to request our Vice Principal, Mr. T.S. Kripashankar, sir, to honor our Chief Guest, Mr. Atheena Milagi Pandian, sir, with a memento and shawl. Thank you, sir.
Fresh beginning always exists. We only have to welcome them. Let me invite our chief guest to inaugurate our Biomedical Association Cyber. Please, sir.
I request all the students standing ovation for applause. The first step towards getting somewhere is to decide you are not going to stay where you are. Let me call upon our association office bearers. President Mr. K. Vigneshwaran, final year BME. Vice President Ms. M. Prabha, third year BME. Secretary Ms. T. Sandhya, final year BME. Joint Secretary Mr. T. Prem, second year BME. Treasurer Mr. T. Rohit Kumar, third year BME. Coordinators Ms. D. Shankari, third year BME. Mr. M. Lokeshwaran, third year BME. Ms. P. Kavya, second year BME. Ms. G. Kavipriya, second year BME. Ms. S. Niveta, first year BME. Ms. K. Shushmita, first year BME. Congratulations to all office bearers.
Our chief guest, Dr. S. Karthikeyan sir, is a great person who is achieving in his field. Now, to know more about him, I would like to call upon Ms. Kirtana to share more details about him.
If your action inspires others to dream more, learn more, and become more you are, says John Quincy Adams. At this juncture, I would like to attribute this proverb to our dignified chief guest. Very special welcome to our chief guest, Dr. Karthikeyan sir. Our delightful chief guest is the best outgoing student in India and a gold medalist in Biomedical College. From 2021, he is servicing the patients as the chief doctor in Amaravati Hospital, Karur. With more pleasure, we are welcoming you to give some valuable speech and guest lecture. Please, sir.
Good morning, one and all. Thank you for the warm welcome. It gives me an immense pleasure to be invited for this grand event amongst these enthusiastic students. I extend my hearty thanks to the principal of VSB Engineering College and vice principal, as also the Department of Biomedical Engineering, the head of the department, for having me here. To be frank, before being invited to this event in the past week, did not have much knowledge about the Department of Biomedical Engineering, except it was part of our curriculum in MBBS about the biomedical research. In the past week or so, I've been going through a lot of studies about the biomedical engineering, and I was amazed to know the role of biomedical engineers in the ever-evolving high-tech healthcare system. Ever knowing about it, on stepping into day-to-day activities, from the start of the day, in every aspect of my hospital, I see the work of biomedical engineers, right from the ECG machines to the ventilators to the drug delivery systems. And I can proudly say, you people are the unsung heroes. You also form the integral part of the community. Your work is indispensable. Biomedical engineers primarily concerned with the manufacturing of the products, creating artificial organs, systems, creating the important medicines such as introduction of insulin to the recent developed COVID vaccination, which gives some ray of hope in the glim years of the past. You people play an integral part of the society. Biomedical engineers, it gives you an opportunity to serve the patient, not directly but an indirect part. You are not only for saving the patients, you people enlighten the patient's life and you give them good quality of life for the disabled patients, like making prostheses, making artificial organs, which is very important to the current scenario of the patients. In the outside world, biomedical engineers, there are a lot of biomechanics, biotechnology, biomedical neural engineering, tissue engineering, and data planning. So I leave it to you guys, and you have a very good set of teachers who will enlighten you on this topic. Since you people are an important part of the society, your health is very topmost priority. As a doctor standing in front of you, I feel I understand more about health than of engineering. So I take this as an opportunity to share my views on maintaining the health of people. And as you people forms the important core in the society, just stepping into the adulthood from the teenage, you in the coming generation in the future, you will make society a great one, and social reformations should start from you people. The health I meant not only a physical health. Physical health nowadays there are a lot of disciplines in it. Many as an experience over it. Many maintain the physical health by doing yoga, doing meditation. doing physical working out in gym and playing games. But there is a lack, I feel, in mental health. Mental health encompasses emotional, social well-being of an individual. It directly involves the people's decision-making skill, the handling stress, and interpersonal relationship. Especially after this COVID lockdown period, because of excessive use of mobile phones and internet, people lock themselves into separate room and indulge in using of internet. There are a lot of gaming addictions, there are online betting addictions, there are lot of sexual harassments we are facing in the last 1 or 2 years or so. So internet offers lot of things for you. In this, we have to have a clarity of thoughts so that we use the best possible way and to make our life easier. There are a lot of negative thoughts going around, suicidal tendencies and depressive disorders. This is very important aspect where many people lock themselves into the cage and never speak up and open up about it. There are a lot of friends and surroundings, your teachers, they will guide you. They've all crossed your path. They would have faced many difficulties and they would have got an experience about it. So people, when you face such difficulties of handling any pressure, please speak up, spend time with your dear and loved ones, and cherish the life which you have given opportunity to live with. So, since mental health, I wanted to stress on mental health. People should come out of the cage and spend a lot of time with near and dear ones and share your views about it and lend help to others so that it is of more useful to the others. So this is the age where you will all remain undecided about your future, about the further career path. But one thing, keep in mind, whatever you choose, perseverance is the success, key for success. Never give up, never say no to hard work. There are a lot of persons who have succeeded in life only with sheer hard work. You people are lucky enough to be studying in the premier institute where you have a backing of your parents and the guidance from your teachers. So strive hard, achieve a goal, be disciplined, move in a streamlined path and study well and reach greater heights. And then please remind to give back to your parents, to give back to your college, to give back to the society. Seeing you people gathered here, it reminds me of my old cherishable college days. The energy level and the enthusiasm of this age group is unimaginable. And if you could streamline this and direct it properly, you can achieve the greater heights. Don't be afraid of failures. The harder you fall, the stronger you rise. I don't want to eat up much of your time, the productive hours of the morning, as there are very enlightened presentations lined up for the day. So I wish everyone a great future, and I wish all the presenters for the today all the best, very best. Thank you.
Thank you for your wonderful presentation and speech, sir. Let me call upon the genial chief guest, Mr. Atheena Milagi Pandian, sir, who is the founder and managing director of AtheenaPandian Private Limited, Telkasi. I request you to present the keynotes on 2D and 3D imaging techniques in dentistry. Please, sir.
Very good morning. So, first of all, I would like to thank God, thanks to the management, thanks to the head officials, principal sir, vice principal sir, head of the department madam, and my friend Jagan sir, and all my community, biomedical community people. So, this is symposium. So, you are all waiting for technical and non-technical event. So now I need a small off and ever for from you to share something about digital imaging, radiology, and the technology actually what needed each and every biomedical engineering in the future. Shall I take your half an hour? Yes, right? Yeah. So, of course, before you are started, you must know everyone. Once you are entering into the college, those who are start knowing about biomedical engineering, in around people, whomever it may be from the family members, or it may be from your friends, or it may be from your college. Everyone asks me about what is biomedical. Even the doctors are saying, no, I don't know what is about biomedical, no. So many of them, எல்லாருமே கேட்டிருப்போம் இல்லையா, இனிஷியலாக ஸ்டார்ட் பண்ணும்போது பயோமெடிக்கலா அப்படின்னா என்ன படிக்கிறீங்க, அதை பற்றி என்ன பண்ணுவீங்க, இதே கேட்டிருப்போம். 4 years I keep on remembering the same words from many of the boys, right? But before you tell about what is biomedical engineering and what is the keynote of it and what is the requirement of it, no? Now, the world is totally belongs to healthcare. The world is totally belongs to healthcare. Of course, there are so many technologies available in nowadays, but the technology remains in particular domain. For example, if you take an electrical, or if you take an electronics, if you take an computer science, if you take an IT, if you take a mechanical, if you take an automobile, if you take some other biotechnology, whatever it may be, it will concern with some other particular domain. For example, if you take an electronics, it is totally dealing with electrical circuits, electronic components that are used in the home, in an office, that's all. It is not related to the human being, right? These are all the things that is aiding support to our human being. But at the same time, just take an example of automobile. Each and every one in the world have nowadays, we didn't have any bikes, we didn't have any BMW cars and Lamborghini car, right? Those who are in the well-fledged, the billionaires having these kind of the cars. But the people, those who are in the huts, the people, those who are in the poor conditions, the poor financial support people, no, they doesn't even have cycle, bicycle. They are just Nadarajala, yeah. So all these things, whether it may be all electronics, automobiles, all these things are not required actually for living. Because the person can able to live all these things. Without an automobile we can live. Without electronic support, electrical support we can live. Because 1,000 years back, 2,000 years back, the human beings are living without all these things. What are the facilities now available, right? But healthcare is concerned. Each and every one of the people in the world, each and every one of the people in the world, whether it may be a poor people or whether it may be a multi-billionaire, whatever it may be, whomever it may be, he is a human being first of all. That human being actually required a healthcare support. If it may be a small diagnosis of fever, or it may be a large diagnosis of cancer, or whatever it may be, the particular person come and approach to the doctor to check what happened to me, whether it may be from the heart or whether it may be from the multi-millionaire or whatever it may be. So what I mean was, we are same for each and every human being in the world. That is what the healthcare. At the same time, if the healthcare is concerned, the 3 important peoples are most familiar. One is, of course, the person, those who are in the life, doctors, then clinicians, and then the engineers. That's called the biomedical engineers. Even though, if you just analyze, during the time of the surgery or during the time of any critical diagnosis is required, the doctor felt something difficult to diagnose something on. Without the devices, without any medical devices, the doctor can't get percentage perfection on the particular basis. The person is affected by this particular disorder. The person is affected by this particular disease. With his naked eye and with his symptoms, the doctor couldn't able to give the 100% satisfaction about the disease. Once the doctor used the devices to predict or to diagnose the whole body with the device, and the particular machine give the readings and particular machine give all the analysis of the patient, then the doctor suggested that and the doctor write the prescription that this particular person is affected by this disease or this other. Just think, if the machine is not there, the doctor is just confused and just write, it may be in the disorder, because in a human body, almost 78 human organs, most of the disorders have similarly 75% of similar symptoms. Corona vandalu kaachirikku, normal fever vandalu kaachirikku, ipo kaachal vandavungalukku corona kedaiyadhu. So that is what the symptoms are similar for more number of the diseases, more number of the disorders. But what is actually the disorder is? without you, without us, without the biomedical equipment. Even the highly familiar people in the healthcare or doctors is also can't able to give the 100% satisfaction about the particular service. That is what we are proud to be a biomedical engineer in the world. At the same time, one more example I can able to give. During the time of the surgery, because you are all well known, during the time of the surgery, it may be a cranial surgery or maybe a open heart surgery. All the wire connections, all the things are connected, vital parameters, heartline machines, anesthesias. So all of these things are connected from the human body to the monitors. Then the doctors start operating the surgery. During the time, any of the vital parameters stop functioning. For example, the vital parameter monitor is shut down. But anesthesia is running, but the heartline machine is running, all the other parameters are running, but vital parameter is not functioning. The doctors are not supposed to continue the surgery. The doctor stops doing the surgery. Immediately, he required the particular monitor need to shut on. Then only I can able to start the particular surgery. So that time, the engineers required what happened to the particular machine to switch on. What happened to the particular machine? Why the particular machine is shut down? During the time, the doctor kindly called. What is where the engineer is? Come on, keep calling. Come on, please, surgery. Keep on doing. Then immediately the particular person do some troubleshoot over the particular machine. Once the vital monitor is shut on, then the doctor start doing the surgery. That is what the importance of the machines. Because patients totally trust, giving a total trust from the doctors. But the doctor, 95% is totally trusting the machines. Without the machines nowadays, because of the technological development, there is all things happen 100 years back, 1,000 years back. Doctor can able to do the surgery, doctor can able to analyze the vital parameters through their neck back, through the problem, right? Now this is the point. Yeah. Yes. So that is what I am saying. So once the biomedical engineer is not there in a multi-specialty hospital, once the biomedical engineer is not there, once you are not there in the healthcare department, even the highly predictable, highly respectable doctors can't able to do anything to the patient. Even a small temperature reading thermometer, temperature reading, put a doctor is searching for the thermometer to check what the particular exact reading of the patient is. So that is what I am saying, my dears. Yeah, whatever the technology you are going to learn, whatever the technology you are supposed to learn something about it, you must know about the depth of. You must know about the depth of the biomedical engineering. That is what the most important thing is. So if you want to know about now, I am going to say something about the dentistry and the radiology. So whatever the thing you are learn over in academics, before you are learning about the particular academic things, because in the second year, I think so, in second year or third semester, you have crossed over electronic circuits, electrical and everything, right? Ohm's law, then electrical circuits law, Kirchhoff's law, then superposition theorems. All the things, electrical, electronic circuits are also studying the same thing, right? What is the reason why the biomedical engineers giving the more importance of studying all this formula is the application. You are doing this, you are keep on learning about the Ohm's law, you are keep on learning about the Kirchhoff's law and all the superposition theorem. The application is entirely different. Where they are going to apply it? They are going to apply all the studying applications into the electronic components and electrical components that are all used in the office and the institutions or in the home. But you are studying the Ohm's law, Kirchhoff's law, superposition theorem, whatever it may be, you are going to apply the same thing to the life-saving machines. That is what I am saying, my dears. So whatever the thing you are learning theoretically, you are going to apply to the particular thing in the life-saving machines department. According to the FDA report, that is Food and Drug Administration report, almost 29,000 biomedical equipments are. That is the only department, that is the only domain actually in the healthcare domain. Much amount of devices available in the world is healthcare. So you are all responsible for knowing about all the 29,000 biomedical equipment. Because each and every equipment is saving the life of the people in indirectly or directly way. So that is what I mean. Whatever the thing you are learning theoretically, you must be more concentrate on that particular thing to apply the particular machine. Because I've just given a same example. for the example I said in previous days, ஒரு டிவி மெக்கானிக் டிவி ரிப்பேர் பண்றதுக்கு ஒரு defibrillator machine ஒரு biomedical engineer ரிப்பேர் பண்றதுக்கு there are a lot of difference. If the particular TV mechanic did any mistakes on troubleshooting the particular TV, there is no issue. But if the biomedical engineer make any fault, any mistake on troubleshooting the defibrillator machine, in some other day, it will kill some people, some patients, those who are requiring the defibrillator machine to give the pulses. That is what each and every companies, they are requiring a much more experience on handling the devices. What is the reason why they are giving more vacancies in the IT field, more vacancies in the computer science? What is the reason why they are not giving much vacancies in the biomedical? Not like that. You know something? In the past 5 years, in the past 4 years, because I am in the field, I am just searching for a job. I am searching for some of the companies to what are all the things they are providing vacancies. In deeply, you just analyze, most of the vacancies are there in the healthcare. But the one important thing is, if you know about the particular vacancies, you are not going to sit in front of the Google. If you want to search the job also, there is a separate scenario you need to follow to catch the job in biomedical. That is what a different scenario you need to know about during the final years and the third year. Because the vacancies in this ESE, IT, and automobile is much smaller when compared to this healthcare. Because according to the MSME startup companies, during this particular COVID period, in Coimbatore itself, almost 121 startup companies are registered. 121 startup companies are registered. They are manufacturing the electrodes, ventilator cups, radiology, especially X-ray, mobile X-ray, and wall mount X-ray. All the things are manufactured. They are startups. But the most important thing is, in the 21 startups, almost 90% actually belongs to the electronics and electronics and company. You need to travel your path. That is the easy way to catch the job. Because in my point of view, as a biomedical engineer, the best option is not go and searching the job. The best option is try to provide a job. That is what I mean. You want to become an entrepreneur. Just imagine, first of all, you can easily be an entrepreneur in biomedical field. You can easily become, because 29,000 biomedical equipments not available. All the 29,000 biomedical equipments are not available in India. But in all over the world, all the 29,000 biomedical equipments is there. You know what is the reason why all the equipments are not available here? There is no importers. There is no manufacturer available in India. So that is the reason why the pathway is entirely different. The pathway is open for you to become an entrepreneur, to provide job for others rather seeking the job to some other companies. So if you are knowing about the particular thing, how to manufacture it and how to create that particular thing, then that makes sense to be a better entrepreneur and better learning purpose. Because one more information, startups start பண்றது பெரிய விஷயமே கிடையாது. 121 startups are there. In that particular 121, none of them got failure. In the revenue is concerned, none of them has got failure, because everyone is manufacturing market trending especially during the time of the pandemic period. Pulse oximeter, oxygen concentrator, then mobile X-ray, wall mount X-ray, CT, all these things are familiar on that particular day. All these people start manufacturing, start providing accessories of all these things they are manufactured. Because of that, they are in the success rate. Even though the pandemic situation is getting over, some of the hospitals and some of the clinics and some of the institutions, they require these kind of the machines to supply. You know what is the reason? The cost. Whatever the equipment we are importing from the Europe and Canada, once you start manufacturing here, the cost rate is entirely different. 70% you can able to save if you are manufacturing here. That is what every hospital they are looking over the manufacturing product from the quantity. Most of the, because in the 2020-21 report radiology X-ray மட்டுமே selling கிட்டத்தட்ட 441 or 455 something. In that 455 in Tamil Nadu, almost 390 X-rays are from Coimbatore startup. Just think about it, my friends. That is what I mean. So rather you are going to search the job, just know the technology and just know the trending of the market and catch the market by creating some of the devices. The product should be from the project. That is what I mean. Okay, everyone says, everyone says that now the expert says, want to create a product, want to create a product, want to create a product. You know, what is actually demanding here? எல்லாமே வந்துருச்சு. வீட்ல யூஸ் பண்ணுங்க. உங்களோட கம்ஃபர்ட்டபிள் லைஃப் யூஸ் பண்றதுக்கு everything is there in a home, right? ஏசி இருக்கு, பெட் அப்படியே சாச்சிக்கலாம், ரிமோட் இருக்கு, ரிமோட்லயே ஃபேன் ஆன் பண்ணிக்கலாம். Everything, all the Android mobile is there, iOS mobile is there. Everyone is technology is developed, but still healthcare only 60% got success. Still 40% is there to know, there to identify. What is that 40% exists? Just imagine. I will give a small example. I am just entering into the topic. Okay. So in our human body, 3 diseases are identified in ophthalmology is concerned. In that 20 cases, only 12 devices can able to diagnose by using the device. Remaining 11 diseases and disorders are able to predict by using the device. So what it means? இன்னும் அந்த செல் காலியா தான் இருக்கு. இன்னும் அந்த 11 diseases கண்டுபிடிக்கிறதுக்கு machine is not available in the world. If in case, if you are creating the particular product, don't think that நான் பண்ண முடியுமா? Don't think that நான் ஃப்ரீயா பண்ண முடியும், இதெல்லாம் எனக்கு knowledge இல்ல. Don't think that. If you are creating the product, at least one product in that 11 diseases or disorders, then you can able to make a patent, and every corner of the world is looking for you. All the ophthalmological company, even the topmost ophthalmological company called Alcon.inc, Japanese company, they also very struggling to identify these kind of the disease diagnostic equipments, especially the disease called retina pigmentosa. Even the doctor knows. Retina pigmentosa is a disorder. The particular disorder doesn't have any devices to identify. Using the symptoms and using the symptoms only, the doctors can able to identify, because there is a lot of difference between the night blindness and the retina pigmentosa. கிட்டத்தட்ட ஒண்ணே மாதிரி தான் இருக்கு. retina pigmentosa நைட்ல கண்ணு தெரியாது, night blindness கண்ணு தெரியாது. So but both are entirely different. Night blindness, we have the devices to identify the person have the night blindness, but retina pigmentosa is similar symptom, but it is not actually a night blindness. Okay, that is what I am saying, my dears. Now I am going to talk something about radiology. So what is the reason why I am taking this radiology is concerned? The trending equipment எப்பயுமே அழியாது. இப்போ நீ அதை படிச்சு வச்சிருந்த அப்படினா, if you know about the radiology very deeply, till in 25 years or 30 years, whatever it may be, the radiology's requirement is much required in each and every corner of the world. So you must know the radiology, not in the booking. Kanpurla irukra, what is X-ray, what is the principle of X-ray? When a fast moving X-ray suddenly stopped with a better target, it is limiting some of the radiations called X-ray. This is not study. This is not the way you are studying the medical equipment. You must touch the particular X-ray tube. You must know how the radiations are generated. You must know how the electrons are moving very fastly when you are applying 50,000 volt. All these things you naturally see the particular thing. Then only you can able to make some of the devices practical. That is what I mean, because in 2011 only, the dentistry, the 2D imaging and 3D imaging, what is the topic today is, in 2011 only it is emerging out. The company called the Carestream, Canada company, Carestream.inc, they are totally belonging to the manufacturing of the dental equipment. Before 2010 itself, all the dentists, they are using the normal X-ray for taking the imaging of your maxilla and toxoplasty. All these regions, ஏதாவது X-ray எடுக்கிறோம்னா normal X-ray தான் just take. For example, you are taking the X-ray of the rib bone. What happened? Sending the X-ray here, and the cassets are behind there, right? Then film is behind there. Then the whole ribs are coming over it. Then the doctor easily find out where the fracture is. But if you are taking the X-ray in the mouth, please remember, while you are taking the X-ray in this region, while you are sending the X-ray here, while you are keep the particular film over here in the opposite direction, what happened? Not only the doctor need to identify this particular area, but in the film, this area is also inbuilt over the film, right? So it is very difficult to identify a particular reason. The Carestream.inc, they are just inventing the sensor called the RVG. Those who are coming for the training, those who are on. So what is the invention called the RVG? That is called radio, visio, therapy. That is that particular radiovisuographic technique. And the radiovisuographic technique of the small sensor. It is as like as a small chip mother. Small chip in the size of the small chip. You know the cost of the chip? The cost of the chip is around 1.95 lakhs. The cost of the chip is around 1.95 lakhs. What it did is actually, while the person required the imaging of this particular region, and the chip என்ன பண்ணுவாங்க டாக்டர் வாயை திறந்து பல்லுக்கு பின்னாடி வச்சிருவாங்க. வாயை திறந்து டூத்துக்கு பின்னாடி they just keep the particular sensor inside. Then ask the radiographer to send the radio cone beam X-ray to this particular region. Then the X-ray is sending this particular area, the sensor capturing all the radiations here itself. So the X-ray radiations could not be come over this particular area. So what actually the doctor requirement that will be absorbed by this sensor, and straight away the sensor is connected to the monitor. So directly within a fraction of a second, because of using the particular radiovisuographic technique, the doctor within a fraction of a second that identified exactly where the particular function is, where the particular problem is. That is what the development is. The most important scenario is the RVG is also a project, students project. The students project, the casting company, they just buy for $20 billion. For the $20 billion, the student project, they are just start selling globally. Just imagine the fourth year படிக்கிற பையன் 20 billion American dollar he got for the invention of the small chip. அப்படி என்ன சார் பண்ணுது அந்த small chip? இந்த அந்த thickness பார்த்தீங்கன்னா 1.5 தான் thickness. 1.5 thickness, it is around 2 centimeter in length and width. That's all. You know what is there in the sensor? You know what is inside that particular sensor? 9 different sensors is available inside it. Actually, the whole radiographic techniques, what we required, before that, we are all well known, the image intensifier, then the cath lab, then they just go to the monitor. All these things, they just keep all these things in a small chip. The 9 different layers are available in the particular chip. All the 9 different layers within a fraction of a second, all the radiation is coming out, coming inside this particular region. The first layer of the sensor converting all the radiations into the electrons. That is image intensified, photocathode. Then all the electrons are converted. Then we need to rush the electron to move towards the anode. Then the photoanode is there. Then the electrical shock, radiation exposure, shock is added. Then shocking observing layer. Then the particular electrons image are converted to a layer. And the 9 layers they are connecting, and the last final ray, it will connect into the data cable and straight away into the monitor. So all that things available in the particular small chip, that is why the cost of that particular thing is 1.95 lakhs nowadays. If in case, if you are creating that particular thing, then what happens? Your name will be globally spread over, right? That is what I am saying. That is what the 2D imaging. Of course, you are all known. The pantanogram, the cephalogram, all these things are available nowadays after the invention of this RVG sensor. The casting make a very important role to creating a dentistry in a brand way. In the before 2010 and before 2009, in OMR Street in Chennai, if you look over around, we can't able to see the dental clinics here and there. But now, each and every 4 shop, 1 shop dental clinic. All of them using this particular RVG. Because of the particular single person created in the Canada, biomedical engineer, they are just creating this particular chip. The globally it will be spread around and get the money, and the revenue is also created, and all the dental doctors get benefited to identify where the exact problem is to be. Hope you understand, guys. So these are all the things actually. I am just giving an example of ophthalmology and dental. HR, every human resource manager required some of the practical how to dealing with the ECG patient. Don't say what is ECG. ECG is nothing but electrical activity of the heart. Don't say. What is ECG? ECG, these are all the knobs there, these are all the electrodes there. We need to keep that particular electrodes over there in the chest region. There are 3-channel ECG, 6-channel ECG, 12-channel ECG. All these things are available. Inside it, we can able to get a peak velocity waveform. These are all the answers they are expecting. They don't expect anything from the books. Everyone says, but so many signals are there. EEG, EFG, ERG, EOG. All these things need an explanation not from the book, practical explanation. So if you are dealing with the particular devices practically, then automatically you can able to tell the answers. EEG ஒரு 5 minutes அவங்களே ஸ்டாப்னு சொல்ற வரை you can able to speak out. Only you can able to get all these things in a practical way. So whatever the things you are going to learn, take the particular mission. Ultrasound. What is ultrasound? Get down. Bookலாம் வேண்டாம் எனக்கு. Ultrasound இதானங்க. More than 20 kilohertz. Of course. Okay. More than 20 kilohertz எல்லாமே ultrasound தான். எது மெடிக்கல்ல யூஸ் பண்ணுவாங்க? 1 megahertz ல இருந்து 15 megahertz. அப்போ 1 megahertz ல இருந்து 15 megahertz என்னங்க? அத கொடுங்க. Probe. அந்த probe எப்படிங்க ஃபங்க்ஷன் ஆகுது? Piezoelectric crystal. இல்லங்க piezoelectric crystal என்னங்க? புக்ல தேடாதீங்க. Take the particular piezoelectric crystal. Everything is available man nowadays. Amazonலயே medical equipments தான் கிடைக்குது. What is that piezoelectric crystal? What is that? என்ன பாருங்க எப்படி how the piezoelectric crystal converting the electrical current into the sound waves. What happens in the electrons? The electrons are breaking னு சொல்றாங்களே. How the piezoelectric crystal break the electrons? Breaks the electron ஆனா பக்காடோ டை ஆட்டமாவா மாறிறதா? How the electrons are breaking and give the sounds? Just imagine. Just to do practically something. Then that thing make curious to do something different in the healthcare domain. That is what I am expecting you all people to do, because you are a post batch here. I hope so. Many of them did the project. Many of them they are doing the project. So the project is not for get passed in the Viva. At the same time, degree is just a paper. The knowledge and the practical exposure what you have in this particular 4 years, that makes you sense, that makes you capability to flame in the future. Hope you understand my dears. So I don't want to waste your time, and at the same time, I will just give some of the motivational speech regarding the biomedical engineering. It's my pleasure to say something about it, and So I am congratulating to all the people, those who are participating now in the technical and non-technical event at the same time, and those who are all belong to the VSB Engineering College also. I hope so. This particular institutions will give much more support to learn about the biomedical equipments in a deeper way in a project. I want everyone, many of the products to be come over from the VSB Engineering College from this year or next year, whatever it may be. So practical exposure is the most important scenario part. Don't study everything only through the book. No, I'm not saying book follow பண்ணாதீங்க. Book வந்து 10 to 20%. Apart from that, whatever the things you are supposed to learn. For example, ஒரு thermometer எடுத்தீங்கன்னா just a thermometer ஒரு equipment பிரிச்சு உள்ள என்ன இருக்குன்னு பார்க்க பழகிக்கணும். Thermometer is cost around 150 rupees. The cost வந்து 150 rupees. நல்லா இமேஜின் பண்ணுங்க. அந்த காஸ்ட் வந்து 150 rupees. அந்த thermometer காஸ்ட் ஒரு நார்மல் அந்த thermocouple அந்த ஒன்னு என்ன வச்சிருப்பாங்கன்னா ஒரு ராட் வச்சிருப்பாங்க. The process is called thermocouple. Because of the thermocouple only the temperature will be rise and give it in the monitor. Okay. So the எல்லாத்தையுமே இண்டிவிஜுவலா அந்த ராட் நம்மளே மேக் பண்ணலாம். The small rod அந்த சைஸ் மட்டும் மேக் பண்ணா போதும். அந்த small rod and the display sensor இதெல்லாம் கிரியேட் பண்றதுக்கு எவ்வளவு செலவு ஆகும்? Only 15 rupees it takes. But the market they selling the thermometer at the cost of 150. Just imagine if you are creating the thermometer by yourself. If you know about the particular thing, what is happening in the thermometer, if you are manufacturing the particular thermometer, just imagine ஒரு எல்லாருமே 150 rupees 160 rupees வாங்கி வச்சிருப்பாங்க டீலர். நீ மேனுஃபேக்சரிங் பண்ணிட்ட, the probability ratio is excellent. If you are saying 15 rupees the thermometer is, it is function as like as the cost of the machine 150. எல்லாரும் எங்க வருவாங்க? Everybody in the market you can able to catch very easily by the price. So because the total cost of the particular machine is 10 rupees, your marginal cost you are just increasing 5 rupees. 15 rupees thermometer வாங்கி முடிஞ்சு போச்சு. You can target at least ஒரு medical shop நீ டார்கெட் பண்ணாலும் கூட போதும். That particular medical shop owner will be spread all the things to the other patients. Then everywhere your thermometer product will be reachable. A small example நான் சொல்றேன். அதே மாதிரி if you are creating any accessories, most of my known students and my known friends know they are manufacturing the functional cup, the medical ventilator cup and the electrodes, ECG electrode, button electrodes. All these things are manufacturing cost, the investment cost is very very low. But the requirement in the healthcare, but the requirement in the medical areas, medical scenarios, they are much more. ஐயோ electrodes வேணும், இமீடியட்டா வேணும், நான் 1000 ரூபாய் கொடுக்குறேன் கொடு, அது 200 ரூபாய் கூட ஆயிடும் மேனுஃபேக்சரிங் பண்றது. You can able to sell that at 700 rupees, 500 rupees long. So that is what my dears I am saying. From the depth la na soliten. Rather you are going to searching the job is very difficult, but you can able to become an entrepreneur very easily in the field of biomedical. That is what at the same time you are if you start creating the manufacturing, if you start manufacturing the healthcare product, you are doing a great job in a servicing field in the healthcare, because each and every person in the world, every human being in the world, whether it may be from the small heads to the maximum billionaire, everyone is required the machine what you are going to manufacture. That is what the best service you can able to provide to the world. Hope I can able to you can able to understand what I am saying, right? Non-technically, everyone, I hope you understand what I am saying, right? So the core technology, I just say you just please note it in the mind and keep following after the technical level and non-technical level is getting over. Keep it in the mind and do start knowing about that particular technology, because in 2 to 3 years, in India is totally turnover in this particular technology. If it doesn't know about that particular technology, you can't able to survive. The 4 technology I would like to say, one is radiology, second is bioprinting technology, the third is prosthetics, what the Saris said, prosthetics and robotics, and finally artificial intelligence and machine learning. All these 4 technologies are most important in outcoming years. If it doesn't know about these particular technologies, you won't able to survive in 2 to 3 years back after. So that is what, my dears, each and every person's, because the prosthetics is much harder. Prosthetics is most useful for the person those who are totally lost their life during the accident. Or accident, very accident, total body is damaged at good. Doctor, but engineers, the prosthetics engineers can create the whole body by using the artificial organs. You know, 65% of your whole human body can able to recreate by using the artificial technology, prosthetic technology. That is what, அந்த மாதிரி ஒரு department, அந்த மாதிரி ஒரு domain தான் நம்ம படிச்சிட்டு இருக்கோம். Just imagine you are at topmost in the world and topmost in the engineering and technology field. You must understand that particular thing, and then knowing about all the technology, you can able to create a product. You are not simply an engineer. You are a biomedical engineer. To be proud to be a biomedical engineer in the global, and you must be true yourself by creating the product. Thank you very much for the opportunity. Thank you.
Thank you for filling our brains with wonderful ideas through us, sir. On behalf of the entire students, I would like to thank our chief guest, Mr. S. Karthikeyan, sir, and guest of honor, Mr. Atheena Milagi Pandian, sir, for spending your precious time out and gracing the occasion with your presence. Thank you, sir.
I request Ms. Kamali to come on to the stage to give details of the event.
Good morning to everyone. I am here to guide you towards your events in a smooth manner. Initially, we start with the technical events. The first event is the paper launch, which is going to be held at auditorium. The second event is Project Expo, which is going to be held at PG block room number 1. The third event is Busy on